Welcome to another edition of the Active MD Patient Education Network's Candid Answers series. Our topic today is adult strabismus. Strabismus is a condition in which the eyes point in different directions. It is commonly termed misaligned eyes, wandering eye, crossed eye, or lazy eye. Strabismus is often the result of progressive, untreated, or unsuccessfully treated strabismus from childhood. It can be caused by an accident or injury and frequently leads to double vision. As many as 4% of the adult population in the United States suffer from strabismus. Many of these adults have been told that their misaligned or crossed eyes could not be treated successfully or was purely a cosmetic procedure. However, recent advances in the management and medical treatment of misaligned eyes has benefited both adults and children, improving their depth perception, field of vision, self-esteem, communication skills, and overall lifestyle. In order to get candid answers about adult strabismus, we met with Dr. Jack Gugino of the Gugino Family Eye Center and some of his adult strabismus patients. Dr. Gugino is a diplomat of the American Board of Ophthalmology. Ophthalmologists are physicians specializing in the comprehensive medical and surgical care of the eyes and vision. They are the only doctors medically trained to diagnose and treat all eye and visual problems, and provide treatment and prevention of medical disorders of the eye, including surgery. Additionally, Dr. Gugino is a fellow of the American College of Surgeons, the chief of pediatric ophthalmology at St. Joseph's Hospital, and a member of the American Association for Pediatric Ophthalmology and Strabismus. He is one of a handful of experts nationwide that specialize in the treatment of adult strabismus. Join us now as we get candid answers about adult strabismus.
So what brings a patient in the adult age group is double vision. And if there is a cosmetic blemish, they're embarrassed about the eyes, or they can't seem to look at other people in the face without embarrassment, they want that corrected. Straight eyes is important from a psychological and physiological standpoint. So we address both issues, the functional, the physiological, and the emotional. There's a huge misconception that adult strabismus can't be treated or is simply cosmetic, the insurance companies won't pay, and don't bother. It is not a cosmetic procedure. We have shown over and again that the correction of malalignment will lead to better binocular vision, and that's important to note. The treatment of strabismus is very possible, very doable, and necessary in the adult age group.
My eye hooked all the way in, and you pretty much saw all white, especially if I was really tired. I was embarrassed to be seen with my eye hooking in. I had had eye surgery since I was 2 years old, off and on, and every doctor I had gone to kept telling me that it wouldn't help my cross-eyed. And they just pretty much told me that by the time I was 60 or in my 70s, they could do surgery on me, but it wouldn't help. Went to Dr. Gugino, and Dr. Gugino told me yes, he could do it, and he did it. And as you can tell now, it's straight.
The familiarity with strabismus and learning the limitations of surgery has led me to become a little more creative. I've extended the limits of how much we can weaken a muscle and have popularized that. There are 6 muscles that control the eye: horizontally, vertically, and obliquely. And depending on the nature of the strabismus, where the eyes are positioned, we will tighten certain muscles and weaken others to align the eyes so that they're parallel. And the adjustable sutures in the adult population or the cooperative young adult has made the predictability of adult strabismus surgery more secure. The manner in which we apply that adjustable suture is one of my innovations, where we don't use a knot, we don't use any ties to increase the bulk of the suture, and it's worked very well. And within a week after surgery, if the positioning of that muscle doesn't accomplish our goal, we can adjust that muscle, the pull of the muscle or the relaxation of that muscle, by simply letting the muscle relax or tighten it to obtain straight eyes. And the patients love it, because if we don't have to adjust, we don't have to remove the suture.
I couldn't control the movement of my right eye, where it was affecting me in everything, my work, driving, reading, watching TV. I was having double vision a lot during the day, a lot of times during the day, and it was a problem for me to focus on something, to be able to read. I have to put my face, to look certain way to be able to read, and things like that. So I felt bad, because it was affecting me. I went to see many doctors. Nobody told me about the operation for the strabismus until this ENT doctor referred me to Dr. Eugene. He knew what the problem that I had, and he assured me, and he told me, this can be operated, this can be fixed. He has done it, for a long time. So I felt great. Dr. Eugene, you are my savior.
The adult can expect that the eyes, once corrected, will be stable, and they can expect to have their binocular vision improved, and the chance of another operation is relatively low. The other important, very important consideration is there are a number of diseases, unlike in pediatric age group, that can produce strabismus in adults. So it's incumbent upon the strabismologist, the doctor who treats strabismus, to make sure that systemic conditions aren't present in that patient.
As a child, I had strabismus, and I grew up in Maryland and had some surgery at Johns Hopkins as a child to correct it. And over the years, it's been about 30 years that it deteriorated. I would notice that my eyes would kind of go off, and as I got older, my husband would tell me, and the kids and some of my coworkers, that sometimes my eyes would seem to drift. So in my profession, I do some public speaking, and just being in the public in general, I just wanted to get it checked out to see if there was anything I could do to repair. I came, I think, a total of 3 times before the surgery, a pre-op, some testing. He actually told me it was a blessing that I came to him now, because maybe in a couple of months or a couple of days it would have been too late, because my muscles had deteriorated so much. So, I'm just very thankful that he was able to help me. He and the staff had talked me through, what to expect. Every step of the way, what the procedure was like, how long it was going to take, what the recovery was going to entail. So, it was, I knew. Nobody likes surgery, but other than that, I was prepared.
The day of surgery, there's no food or drink after midnight. Usually the surgery is done under general anesthesia, and the patient goes home the same day. The pain and discomfort is treated with eye drops or oral medication, and the experience, with the exception of occasional nausea, is an uneventful one. If you have adult strabismus, your eyes aren't properly aligned either in the horizontal or vertical meridians, then you should look for a surgeon who has dedicated his professional life to treating adult strabismus and pediatric patients. Look for the person who's had a fellowship in pediatric ophthalmology, a person who has experience, and a person who has a good reputation in the community.
I know this is going to sound weird. I didn't really like to wear makeup, especially eyeshadows, because I felt like it would draw attention to my eye. Now I do love to wear eyeshadows. I love to wear makeup, and I know that sounds funny, but I do, because I know that it's corrected and that not everybody's going to be staring at it.
It's incredible. It's incredible. It's a lot better. It's incredible. From last year when I have the surgery, now I'm reading. I am reading books like crazy. I don't have any problems. I used to hate go shopping because I couldn't distinguish. I have to really focus to see everything. Now, no, the change is incredible.
If you have adult strabismus, I want you to know that it can be repaired. You can feel normal and confident about yourself, and I would highly recommend that you see Dr. Gugino. He was amazing and he did wonders for me.
Thank you for watching Candid Answers about adult strabismus. For more information, contact Dr. Gugino and the Gugino Family Eye Center in Tampa, Florida.